Hello and welcome to the 48th Annual AAKP National Patient Meeting, Transforming American Kidney Health, Patients Take the Lead. My name is Fiona McKinney and I've been an in-center hemodialysis patient for the past 15 years in New York City. I'm originally from Dublin, Ireland, and was diagnosed with glomerulonephritis when I was 16. I was in my early 20s when I left Dublin for New York to seek alternative healing. Through that work, I managed to stabilize my condition for over 20 years. But in late 2007, things changed, and I ended up on dialysis in April 2008. Dialysis is exhausting and debilitating, but thankfully, with the right care and support, most of us can live a pretty full and meaningful life. I also have the honor of serving as an AAKP Ambassador. Being an AAKP ambassador has allowed me the opportunity to advocate on behalf of other patients also dealing with kidney disease. As a member of AAKP, I share the message that every kidney patient has the most important voice in determining their care plan. It is imperative that an environment is created that supports kidney disease research and innovations so that we are continually advancing care, improving treatments, and providing solutions for unmet patient needs. And when those innovations are FDA approved, it's crucial that all patients have access and the right to choose the treatment that is best for them. This, of course, would be in consultation with the doctor they choose to care for them, so that every patient can live their best life and achieve their aspirations. And with that, I am pleased to introduce our next session titled Impacting Community Health at the Local Level with National Implications. Today we have two friends and allies of AAKP. Joining us to co-present are Dr. Barry Smith and Crystal Matthews. Dr. Smith is a member of the AAKP Board of Directors and holds the esteemed position of President of the Dreyfus Health Policy and Research Center. True to his passion for holistic kidney care, Dr. Smith is working to develop an inclusive and comprehensive model for health system reform that prioritizes wellness. He hopes to enhance the overall quality of life and unlock the potential of individuals living in underserved communities. Rather than viewing the factors commonly known as the social determinants of health as obstacles, Dr. Smith believes in harnessing them as catalysts for positive change and improved well-being. Joining Dr. Smith is Ms. Crystal Matthews. Ms. Matthews is the director of the Dreyfus Health Policy and Research Center. Her passion for patient education and advocacy served her well as a critical care nurse and manager and allowed her the opportunity to serve as lead nurse and team member for several medical missions in both Eastern and Western Africa. Dr. Smith, Ms. Matthews, I turn things over to you.
I am delighted and honored to be here at the 48th Annual National Patient Meeting of AAKP. And I think what we have to talk about today is very important. And the first thing I'm going to do is change the title a bit of the National Patient Meeting, because where it says Transforming American Kidney Health, Patients Take the Lead, I'd like to say people with kidney disease or experience with it are going to take the lead. And not only are they going to transform kidney disease, but I think they can act to improve the U.S. healthcare system and make it better. So that's what we want to do today, is think together. The question we have, what about preventing or slowing the progression of chronic kidney disease? Can it be done? Who should do it? So that's what we want to think about today. And here you see the brain that we all have to use today. And we're going to use that to see if we can get a new understanding of where we are. We want to see things in new ways, and we want to see if there are some new possibilities that we can put together here. Now, it is true that it's important to think about kidney disease for its own sake, but we also need to consider today what it can teach us all about change aimed at improving the U.S. healthcare system, as I said. What I want to do is start you out with some basic facts. I think most of you in the audience know these facts, but I think it's good to bring them into focus. The first one is right in the center, and this is from the Centers for Disease Control, is that more than 1 in 7 adults in the US today are estimated to have chronic kidney disease. And that amounts to about, really says 35.5 or 37 million people today. And there's some other things about this that are important to remember. As many as 1 in 9 people do not know they have chronic kidney disease and could be doing something to prevent it from progressing. 1 in 3 people don't know that they have severe chronic kidney disease and are close to end-stage disease and requiring dialysis and or transplantation. And altogether, in that stage, with people with kidney failure, we have over 800,000 people. So this is a big health problem. Now, what it's all about, what kidney disease is all about, and again, you know this, but let's remember, because I think we need to put a lot of information together to really move forward and see if we can answer the two parts of our question: kidney disease and then improving the healthcare system. So what we see in the slide here is the nephron. That's the basic unit of the kidney. It takes water out of our bloodstream. It takes the ions out. It manages the balance of all of these things. It gets rid of waste products. We see the fact that in chronic kidney disease, well, that's about the gradual loss of nephrons. So each of us starts out with 2 million nephrons, 1 million per kidney. And when dialysis or transplantation is necessary, that's when there are no longer enough nephrons to allow the kidneys to perform their job, which, as we said, is about water balance, ion control, sodium, potassium, and waste removal. And some of the things that we use to measure the function of the nephrons, on the left-hand side here, we see the glomerular filtration rate, GFR. When that is above 60, that's in the normal range, which you see in green, and it slowly moves into the yellow. That means chronic kidney disease, and then kidney failure is below 15 on this scale. And in addition, it's not just the filtration rate that changes, but the membrane of the nephron is also damaged in chronic kidney disease, and it begins to leak protein. So we see a protein known as albumin, which we all have in our blood, leak into the urine. And so that's another way we can tell that we have a problem with our kidneys. Let's just review a few facts again about CKD, chronic kidney disease. Again, these are figures from the Centers for Disease Control and the National Institute of Diabetes and Digestive and Kidney Diseases. So kidney disease are a leading cause of death in the United States. That 37 million adults that we talked about are estimated to have it, and most are undiagnosed. 40% of people with severely reduced kidney function, not on dialysis, are not aware that they even have chronic kidney disease, and that's a serious problem. Every 24 hours, 360 people begin dialysis for kidney failure in the United States. And then there's a very important point here. In the United States, diabetes and high blood pressure are the leading causes of kidney failure, accounting for 3 out of 4 of the new cases. And the bottom line teaches about costs, which are not insignificant. So it's good to keep those in mind, about $125 billion. Now, based on the slide that we have here, the major causal factors of chronic kidney disease, diabetes, and 95% of diabetics have type 2 diabetes. So we're talking about what we eat and drink and the way we manage our blood pressure, blood sugar, I should say. And then we have our blood pressure, another problem. And we don't think about these other 3 things, body weight and physical activity and stress levels, as also important in the development of kidney disease. So let's look at those three things or four things momentarily. First of all, diabetes. 37 million Americans have diabetes. It's 1 in 10 Americans. And 90 to 95% of them, as we said, have type 2 diabetes. Most of the type 2 diabetes is in older people, but more and more children, teens, and young adults are developing it, which means that they are more at risk of chronic kidney disease because diabetes is, again, a major factor. And if you look around the world, so these are some data from 2017, you're talking about 462 million individuals have type 2 diabetes. It's about 6 1/3% of the population. It's a very large part of the population. It's responsible for 1 million deaths per year. It's a serious, serious problem. And look at hypertension as another problem for kidney disease. Hypertension or high blood pressure, as you know, puts you at risk for heart disease and stroke, as well as chronic kidney disease. And in 2021, hypertension was the primary or contributing cause of almost 700,000 U.S. deaths. Nearly half of U.S. adults have hypertension, high blood pressure, defined as a systolic blood pressure greater than 130 millimeters of mercury, or a diastolic blood pressure of greater than 80 millimeters of mercury. People take medication, but relatively few of them, as the slide shows, have very good control. And high blood pressure, which causes chronic kidney disease, but on its own costs the U.S. about $131 billion per year, and that's an average of 12 years, so it's a pretty stable figure. Where does hypertension occur? And you can see in this map, again from the CDC, that the bright dark red areas are the areas in the country where hypertension is most prevalent. And that means there are places where we're likely to see a lot of chronic kidney disease as well. And you can see it's in the southeast, particularly of the country, and extending to the west into Alabama, Mississippi, and Texas. Oh, it's a big problem. It's all over the country, but some areas have much more of a problem than others. And if we look at the next slide, which mentions obesity, we can see something that's interesting. It's a very similar pattern, not quite the same, but if you look at Appalachia, the bright red area, obesity is a very big problem, and this is 2021 data. But then the middle of the country has a lot of obesity, and again, this means high risk factors for chronic kidney disease. And then let's go on to the last factor, stress. And this is something that all of us have. You can see, well, no matter what category you fall into here, the stress is pretty equally distributed. But this causes our bodies to secrete hormones, steroids, norepinephrine, and so forth, which increase blood pressure and also contribute to kidney disease. So with this background in mind, let's rephrase our question for today. Does chronic kidney disease and the human health burden it imposes, and you're all familiar with that, these burdens are huge, have to be as common as it is, affecting roughly 1 of every 7 people in the US today? And the answer to that is very simple. I think the answer is no. What we need to do is we need to deal with diabetes, blood pressure, body weight, physical activity. The more active we are, the better off our health. And then we need to do something about those stress levels. Very, very important. So what we're saying here, I think, is that the kidney and chronic kidney disease are actually our teachers. What chronic and end-stage kidney disease are telling us all is that we need to broaden our understanding of what health is if we are to effectively prevent CKD and end-stage disease, ESRD, going forward. And I'd like to make a point that Kent Bressler, who is a kidney patient and on the board of AAKP, made to me not long ago. This is an urgent matter because the longer we wait, the worse kidney function is getting in this large population of Americans that have it, and this shouldn't be happening. So let's think again a little bit more. Remember, we said that chronic kidney disease is the gradual loss of nephrons. We all start out with 2 million nephrons, and we lose them over time. And that's the thing we need to stop. So how do we do that? Now, there's an important point I want to make here is that the kidneys do not exist by themselves. They are a part of our bodies and interact with all the other body systems and the world around us. So we tend to talk about kidney disease in isolation, but that's not really the right way to do this. And we want to make this point clearly because if we're going to stop kidney disease, we have to bring these other things into consideration. So in the next slide, we see that the kidneys are in relation to the heart and the cardiovascular system. And this is where blood pressure becomes important, because if the pressure in the bloodstream is higher and our arteries is higher, it damages the kidneys. And then the kidneys are not sitting in empty space. They've got the pancreas, where diabetes is a problem and where type 2 diabetes, insulin resistance develops. We've got the liver, we've got small and large intestines where the nutrition comes from that can also damage our kidneys. So we need to put the kidneys into a context where we understand where they are in the body, but then we're still missing a piece. Let's ask the question of what is health? And I think there's a wonderful definition of health from the World Health Organization back in 1948. So it's almost 80 years old, and it's still a good one. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And notice those three words: physical, we've talked about; mental, that gets us back to stress; and then social. Now, so the kidney lives in the real world, and I don't think we often think of it that way. But instead of thinking of health, we might want to think about wellness, because that's the whole body and the body in the environment around us. And health is not something unto itself, and the kidney isn't something unto itself. Let's put the kidney into the context of the real world, because the health of the kidney and our general health is dependent on a lot of things. Biology and genetics, the things we usually think about, are really only responsible for about 40% of kidney health and really of our overall health. And I don't think we think of this very often. The political climate, the environment, entertainment, physical activity we mentioned, so we know about that. What about our employment? What kind of child care do we have? What kind of care do we have at home? And if you look at the psychological and emotional factors, again, we're getting back to stress, and that has an influence on the kidney. And in the next slide, we see a very interesting thing. Don Berwick, who was the U.S. Commissioner of Medicare and Medicaid under the Obama administration and is presently a pediatrician at Harvard Medical School and a founder of an important group called the Institute for Healthcare Improvement in Boston, talks about health in this way. It's health cost coverage, food security, housing security, emergent or pandemic needs. That gets us into COVID, which is a little bit more of a worry today than it was a year ago. But prison health, voting rights, education, because if you're well educated, you often take better care of yourself. If you don't have that education, you don't have the resources. And then you've got climate and decarbonization, early childhood development, the elderly and loneliness. You see, the kidneys now are operating in this very complex environment. We talk about increasingly today how the social determinants of health, such as housing, employment, our economic resources, our finances. We talk about these things as determinants that define what our health is going to be. And I think we need to rethink those too, because many of those things that we saw on that last slide are things we can change. And those things we talked about in relation to diabetes, our nutrition, our blood pressure, and so forth, those are opportunities where we can make a change. And some of those changes are not just in the medicines we're prescribed, but they're in the environment in which we live. So when we begin to put all this together in terms of kidney care and kidney health, as well as our whole healthcare system, because what we have today, and this is a point Don Berwick has made very strongly, we have a very good, although expensive and very capable repair shop healthcare system, but we need to add a community-led and driven pre-access system component to our healthcare system if we're going to prevent kidney disease and make us healthier. That is, we need to take better care of ourselves before we get to the repair shop. We need something different in the community. And in the next slide, you'll see what we're talking about. On the right-hand side of this slide, you see health, well-being, access to the health system, primary clinic, emergency room, inpatient, outpatient. That's the system we have today. The system that we need to add to this is the pre-access system, which is community-based. A lot of this is how we take care of ourselves, how we eat, how we take care of that blood pressure, our physical activity, how we deal with stress. And this system is vital because it brings us back to what we can change. We can change what we eat and drink. That's hard to do in the emergency room of a hospital or in an inpatient bed. We can change our body weight. We don't need to have high body mass indexes and be obese. We can change our physical activity. We can change our blood pressure. We can, with physical activity in particular, and we can certainly change our stress levels. I think one of the important things we have here, we have a lot of resources in the community to change things, but we don't use them as well as we should, and they need to be brought together. So that's another important point. We have all these resources in the community, but they're all siloed. They act separately. They don't coordinate, and we need to get them coordinated to have a bigger impact on this pre-access aspect of our healthcare system that we need to develop. Now, to bring this to practical reality, I'm going to turn to my colleague, Crystal Matthews, to talk about what we are doing today in East New York and Brooklyn to develop a system for this community-driven, this pre-access system for better health. So, Crystal, I'm going to turn it over to you.
Thank you, Dr. Smith. As he mentioned, one of the major things that we have to deal with is making sure that everyone is working together, that we really are warriors for change for the better. And this comes as a group effort. There's no one man is an island. We have to work together to see that we prevent kidney disease. And it is possible that we're able to build a better, more sustainable healthcare system, but it will take us all to do so. The pre-access component is very important. This is what we deal with and what we encounter before you get to the healthcare system. We know just how important it is to see that family members, residents of the community, everyone is aware of what they can do to take ownership of their own health before we get to the hospital system. There's so much we can do for our health here, and that's something that Rise Up East New York focuses on. And community is a very big part of that as well. Just as we were mentioning, you have individuals, we have family, everything plays a part, but community plays one of the largest parts in seeing that we're able to move forward with a pre-access component of our healthcare system. Rise Up East New York is interested, and our focus is building the local community-based model here in East New York, a model that can spread nationally. The whole mission is to see that we transform U.S. healthcare and quality of life for the better, preventing CKD and its progression. So our vision is to include East New York among the healthiest, most equitable, long-lived, and best quality of life communities here in New York so that it can be a model for improving urban areas all over the U.S. Our mission is to see that we're mobilizing the community residents. We're bringing together partners. We act as that liaison to make sure within East New York and the surrounding neighborhoods to make sure that we're driving the local solutions here to improve better healthcare and quality of life. East New York is a great place to live, a great place to thrive, and we want to make sure that the residents here are able to show exactly what East New York has to offer. So here's just some demographic information. East New York is comprised of about 3 zip codes. There are roughly almost 200,000 residents now. The median income, as you can see, is about $30,000. There are 11 public housing developments, in addition to Starrett City, another high-rise development that's here. We have 18 homeless shelters. There's high male incarceration rate. With that comes poor nutrition. So we have 1 in 3 people who are hypertensive, obese. We have 1 in 6 who are diabetic. So there's a high CKD rate. There's also something that we call and that we considered no future syndrome, where we have a lot of high school students who are figuring, what's the point in doing more when the community and life has nothing to offer them? So there's a 20% high school dropout rate. And in addition to all of that, there's also a 4 to 10 year less life expectancy here than our neighbors, maybe across the river or in other neighborhoods. So that's something that's very important that we have to focus on. And that's just showing where we are here in East New York. So Rise Up East New York, we really focus on chronic disease awareness, education, screening, and finding these interventions for risk-based very early on. So a lot of what we do is focused on education. We have the demographics. We know what the higher things are here. We have obesity, we have hypertension, we have kidney disease, diabetes. So what we seek to do is educate the residents. We perform screenings as well and early interventions if we're able to get in with the families and the residents that are here in the community and they feel that we're trusted members of the community, then we're able to share with them what's necessary to help improve their health before getting to the larger healthcare system. So as you can see here, we're screening to optimize wellness. So you can see where we take a look at height, weight, BMI. We have screening programs where we're working, especially right now, with the NYCHA housing development, which is the New York housing development. So what we're doing is putting together screening programs where we have the height, weight, we're able to check hemoglobin A1Cs, we're able to check different labs to make sure we can see where residents are, because not all residents necessarily have a primary care physician. So it's so important that residents know that in order to start or get in that path of wellness, it starts with a partnership with a provider and a healthcare system that they trust. So what we do is we build trust in the community so they will see the importance of doing so. So we have actually partnered with One Brooklyn Health System, a wonderful community hospital-based system here in East New York that serves many of our residents. What we want to do is foster that trust so that residents know that this is a healthcare system they can go to where their needs will be met, that their best interests will be considered, and that they can also be placed on the path of wellness. So that's our referral partner. We refer patients and those who we come into contact with here in the community to our One Brooklyn Health System. So Rise Up East New York, we're focusing on improved nutrition and food security for East New York to help prevent chronic kidney disease and end-stage renal disease. So we're focusing on making sure that our GFR is staying within the normal range. So you'll see, we actually are focusing on nutrition and food security. So with that, we're looking at food banks. East New York is rich in community gardens. We have more than 55 gardens just here in our area of East New York alone, where we're able to think about growing food locally that will be able to sustain children who are in school, just the residents of East New York itself. We also have plant powered, and we have our middle schools and public schools that have hydroponic farms and labs in the schools themselves. All of our local elementary schools here in East New York are now outfitted with a hydroponic lab. So we're actually growing food in their classroom that can then be shared with other residents in the neighborhood and the students and their families as well. So with that comes a partnership with our local community board, also with other nonprofits and other CBOs that are here in the area as well. It's all about what we can do together as a group to prevent siloing, to improve the health of the residents here in East New York. So this is what I was mentioning a moment ago. All of our elementary schools here in East New York are now outfitted with a hydroponic lab. So we're currently in District 19. So they're actually growing vegetables in their classrooms. So in addition to it just being science education, here they are able to now provide healthy food to the families of the students of the school and quite possibly residents of East New York as well. This serves as a great model of what is possible when everyone is working together for the common good, which is improving the health of our residents here in East New York. So the classroom, as we mentioned, is a place for teaching and learning science, but also producing these vegetables. So this is great. As you can see there, all 36 schools have them, and 250 schools citywide have these facilities as well. So Rise Up East New York is thinking about a program we call East New York Eats. So it's a new business venture that we're thinking about where we actually have farmers that are actually in upstate New York, where they have farms where they're growing excess vegetables that they're unable to sell there. So what we're doing is putting together partnerships where they're then able to transfer that food here to the 5 boroughs, locally Brooklyn, here where we are in East New York. We're then able to take that food, sell it at a low cost to the residents here of East New York, where they're able to get fresh food, where sometimes we have real issues with food deserts here in East New York, where the quality of food that is offered isn't necessarily optimal. So if we're able to now partner with farmers who are here in New York State, who can provide vegetables to the residents of East New York, that's a win for us, because here we are able to see that there's fresh fruit, fresh vegetables, and residents can see themselves that this is something they can do on their own to help improve their health. So along with that as well, if we're doing this, it also helps to increase the number of jobs that are now available to the residents that are here in East New York. It allows us to feed those families who are maybe single parent homes, and they're the only ones in this one income. So here we are able to see about how we're able to provide additional resources and food for them to be able to have as well. So Rise Up East New York is about educating and mobilizing the next generation as well. It's all about future leadership. We definitely want to make sure that our young people are represented, that they realize that health is wealth, and if they're able to get a handle on their health now at a young age, they're then able to share that information with not just themselves and their peers, but with their family members as well. We want to make sure that health is seen as multi-generational. We want to make sure that everyone realizes that having your health is having wealth. So that's something we're focusing on as well. So we're actually partnering with the Brooklyn District Attorney, Mr. Eric Gonzalez, and we've actually put together a youth summit that we had recently. So what we did was we partnered with larger 4 high schools that are here in East New York, where we performed this youth summit, where we had breakout sessions, we had career opportunities, we had people who are here from the local trade associations, because we want to make sure that that no hope syndrome, then thinking that they do not have a future, just isn't true. And that there's a lot that they can do and that they have control of their lives and their future careers. It was a huge success, and we're looking forward to collaborating with not just those local high schools that we focused on at that particular time, but other high schools here within our district, outside of the district, so that they can see the importance of it as well. So Rise Up East New York has this is our program and youth programs for wellness. So we focus on not just the elementary schools, but high schools as well. We want to make sure that those who might have graduated or have been pushed out of the education system, that they also realize that there's a place for them as well. This is where we start to focus on trade associations and unions. So we have representatives come in to speak to the young people in the neighborhood about that as well. We also see about mentoring services, because it's so important to make sure that no no one feels left out or feels alone. It's a group effort. It's just like with kidney disease and everything else. If it's holistic, we have to have a holistic approach. We have to make sure that we are our brother's keeper, which is a saying that is really ingrained in the residents of East New York. We are our brother's keeper. It's important for us to make sure that we not only thrive and we're moving forward, but that our family, our neighbors, and other residents are as well. So at this time, I'm going to bring Dr. Smith back to finish our presentation.
Thank you, Crystal. And I noticed one of the things that you had on the slide was problem solving for better health. And what we want everybody in the community to be able to do is solve the problems that he or she sees. And we're not leaving this just to the professionals. So in terms of health, it's not just the doctors that solve the health problems, like the kidney problems. It's in the community. We take care of each other. We get ourselves to better health. And problem solving for better health is a technique we've used over 35 years. And really, what we're saying is if you want to solve problems, you have to have the right tools. And so this problem solving tool is one that we want to teach to a large percentage of the people in the community, doctors, nurses, but then high school students, mothers, fathers, everybody we can find to do this. Because let's face it, East New York, like every community and family, has both big and small problems. But each community also is a community. It has its families, its individual residents, but when they all act together as a community, they can be very powerful. And it gets away from this siloing that we talked about earlier, where a lot of good efforts go off in different directions and don't reinforce each other. So we need the ideas that everybody has, and we need their action to achieve wellness and better health. Just to mention a little bit about this tool, as I said, we've used it for 35 years, and it's pretty simple. It's about identifying and defining the problems, because often we don't do that very well. And then we need to look at causes and at contributing factors, because once you know the cause of something like obesity, you can begin to talk about possible solutions. And then it's tied to drawing up an action plan. And the most important thing is that things get done so that the ideas are put into action. And we can look at success or failure after that. And if we need to reattack the problem and try a new solution, that's all part of it as well. But this has been used since the 1980s in 35 countries, and we know it works. And the interesting thing is that it works extremely well in places where there are no resources, where people have very little. And a favela in Rio de Janeiro is a good example. A small village in El Salvador that has no resources. You can go to Africa, you can go to Asia. It's true all around the world. And certainly there are communities here in the US where we don't have the resources, but we have humans that are capable of making great change. They can prevent kidney disease, and they can make people healthier in the sense of wellness, total health. So Crystal and I have one question together for all of you is, will you join the struggle together with the AAKP, the American Association of Kidney Patients, to win this struggle? Because we think that the struggle is winnable. It's quite doable to win it. And the gains for humanity are enormous. So we're asking you today, what is your answer? Will you take up the challenge and make it happen? Here we have Martin Luther King with his speech about the dream. The March on Washington was just about 60 years ago. So the answer is yes, we're going to do this. The dream can be realized. Again, whether it's kidney disease or whether it's other health problems and whether it's a better life for everyone, that's what we want. And all of us have to work together to do this and unleash the potential of people in all our communities to solve the problems that remain unsolved. So thank you all for listening, and we'll look forward to your action.
Thank you for that wonderful presentation. Your work is paving the way for a brighter and healthier future for all. On behalf of AAKP, we look forward to supporting your efforts and bringing your program to other communities in need across the US. I'd like to thank everyone for joining this session.